Ever pondered over how doctors examine the respiratory system? Well, today we're going to unravel that mystery. The examination of the respiratory system is a fundamental aspect of medical practice, and it's not just for doctors but for medical students too. Why? Because the respiratory system plays a vital role in our survival. It's the machinery that ensures every cell in our body gets the oxygen it needs to function and thrive. Now, before we dive into the hows, let's take a brief look at the whats. The respiratory system, in simple terms, is our body's ventilation system. It's like a complex network of airways, blood vessels, and muscles, all working together to get oxygen in and carbon dioxide out. From the moment we take our first breath until the last, this system never stops. It's always there, working tirelessly in the background, keeping us alive, one breath at a time. It's a marvelous piece of biological engineering that deserves our utmost respect and understanding. But why is it so important for medical professionals to know how to examine it properly? Well, think of it this way. If there's a problem with this system, it can affect the entire body. It could be something as simple as a common cold or as serious as lung cancer. And the sooner we can identify these problems, the better the outcomes can be. That's where the examination comes in. It's like a detective's toolkit, helping us uncover clues about what's going on inside our bodies. In the following scenes, we'll be covering the essential tools needed for the examination, and we'll take you through the inspection, palpation, percussion, and auscultation phases. Each phase is a crucial step in the examination process, and we'll explain how they all fit together to give a complete picture of a patient's respiratory health. So buckle up as we delve into the step-by-step process of examining the respiratory system. Before we begin, do you know what tools doctors use for this examination? Top of the list is the stethoscope, an essential instrument in any respiratory examination. The stethoscope is a doctor's best friend when it comes to diagnosing lung conditions. This tool, invented by René Laennec in the early 19th century, allows doctors to listen to the internal sounds of a patient's body. The stethoscope's chest piece, which is placed on the patient's chest or back, picks up the sounds produced by the heart and lungs. The tubes carry these sounds to the doctor's ears. The sounds of the lungs can tell a doctor a lot about a patient's respiratory health. They can detect abnormal sounds such as wheezing, crackles, or decreased breath sounds, which could signal a range of conditions from asthma to pneumonia. With these tools in hand, doctors are equipped to thoroughly examine the respiratory system. The first step in any respiratory examination is the inspection phase. But what does this entail? Well, let's delve into it. The inspection phase is all about observation. This is where you, as a medical professional, rely on your keen senses to gather vital information about your patient's respiratory health. It's a non-invasive process that provides a wealth of knowledge, setting the foundation for the subsequent stages of the examination. Firstly, make note of your patient's breathing patterns. Are they breathing rapidly or slowly? Is their breathing shallow or deep, regular or irregular? These patterns can offer valuable clues about the state of their respiratory system. For instance, rapid, shallow breaths may indicate a problem like pneumonia, while slow, deep breaths might suggest a condition such as diabetic ketoacidosis. Next, take a moment to observe the patient's skin color. Cyanosis, or a bluish discoloration of the skin, can suggest low oxygen levels in the blood. This could be due to a variety of conditions, such as chronic obstructive pulmonary disease, also known as COPD, or a severe asthma attack. Additionally, pay attention to the general appearance of your patient. Are they using their accessory muscles to breathe? Are they leaning forward to catch their breath? Or perhaps they're sitting up straight, but appear uncomfortable. These signs could indicate respiratory distress. The inspection phase is also the perfect time to notice any visible abnormalities on the patient's chest, such as deformities, scars, or skin changes. These might hint at past surgeries or underlying conditions that could impact the respiratory system. Moreover, don't forget to observe the patient's nostrils. Flaring nostrils can be a sign of respiratory distress, especially in children. Lastly, consider the patient's overall demeanor. Do they seem anxious or distressed? This could be a sign of hypoxia, a condition characterized by inadequate oxygen supply to the body. Remember, this phase is about more than just looking. It's about understanding what each observation could potentially mean for your patient's respiratory health. Observation is key, and it sets the stage for the rest of the examination. Following inspection, doctors move on to the palpation phase. But what does palpation mean in this context? In simple terms, Palpation is the process of using one's hands to examine the body, particularly the chest and back in a respiratory examination. It might seem like a straightforward process, but it's actually a very nuanced skill that requires a keen sense of touch and an understanding of anatomy. During the palpation phase, doctors are essentially feeling for any abnormalities that might indicate a problem with the respiratory system. This could be anything from a mass or lump to areas of tenderness or pain, which could suggest inflammation or infection. The doctor's hands glide over the skin, applying varying degrees of pressure to feel the structures beneath. In addition to identifying abnormalities, palpation is also used to confirm symmetrical chest expansion. The doctor places their hands on both sides of the patient's chest and asks them to take a deep breath. By comparing the movement of their hands, they can assess whether both sides of the chest are expanding equally. If one side expands less than the other, it could indicate a problem such as a collapsed lung or pleural effusion, where fluid builds up between the layers of tissue that line the lungs and chest cavity. While palpation can provide a wealth of information, it's important to remember that it's just one part of a comprehensive respiratory examination. It should be used in conjunction with other examination techniques to provide a complete picture of a patient's respiratory health. So, why is palpation so important? Well, think about it this way. Our eyes are powerful tools, but they don't tell us everything. We can't see beneath the skin or through the chest wall. But by using our hands, we can feel what's going on beneath the surface. We can detect subtle changes in texture, temperature, and movement that might not be visible to the naked eye. In conclusion, palpation is a powerful diagnostic tool that allows doctors to feel what they can't see, making it an essential step in the examination. Whether it's confirming symmetrical chest expansion or identifying potential abnormalities, the information gained through palpation is invaluable in the diagnostic process. With palpation complete, doctors then proceed to the percussion phase. Curious about what this involves? Well, let's dive right in. Percussion, in the context of a respiratory examination, is a method used to assess the underlying structures of the chest and back. It's a simple yet effective technique that doctors have been utilizing for centuries, even before the advent of modern medical imaging. So, how does it work? The doctor will gently tap on the patient's chest and back using their fingers. This tapping action produces sounds that can provide valuable insights into the patient's respiratory health. It's a bit like playing a musical instrument where different notes can tell you a lot about what's going on inside. The type of sound produced can indicate whether the underlying tissue is filled with air, fluid, or solid material. For instance, normal lungs filled with air will produce a resonant sound similar to a hollow drum. In contrast, fluid-filled areas, such as in cases of pneumonia, will yield a duller sound. But it's not just about the type of sound. The location and extent of different sounds can help pinpoint the area of concern. If a normally resonant area suddenly sounds dull, that's a red flag for doctors, indicating a possible problem. It's important to remember that percussion isn't just about identifying problems, it also provides a baseline for future comparisons. Regular percussion can help track the progress of a disease or the effectiveness of a treatment over time. Now, it's worth noting that while percussion is a valuable tool, it's not infallible. It's just one piece of the puzzle in a respiratory examination. It must be used in conjunction with other examination techniques and diagnostic tools to provide the most accurate assessment. Percussion gives doctors a sense of what's beneath the surface, and it's a crucial part of the examination. It's like a window into the body, providing a glimpse of what's happening inside without a single incision. So the next time you hear that rhythmic tapping during a checkup, you'll know there's a lot more to it than meets the ear. Finally, doctors reach the auscultation phase. Wondering what this phase is all about? Well, let's dive in and uncover the mystery. The auscultation phase is a crucial step in a respiratory examination. It's where the rubber meets the road, or rather, where the stethoscope meets the chest. This is the phase where doctors use this simple yet powerful tool to listen to the sounds that your lungs make. It's like eavesdropping on your body's inner workings, and it gives doctors vital information about your respiratory health. Now, you might be wondering, what exactly are doctors listening for during this phase? Great question. They're listening for a variety of things. Normal lung sounds, for instance, have a certain rhythm and quality. They're like a gentle breeze rustling through the leaves of a tree. However, abnormal lung sounds, such as wheezing or crackling, can indicate issues like inflammation, infection, or blockages. These sounds are more like a storm tearing through those same leaves. By recognizing these differences, doctors can identify potential problems and take necessary action. But it's not just about identifying abnormal sounds. The auscultation phase also allows doctors to assess the volume of air moving in and out of your lungs. By asking you to take deep breaths in and out, they can gauge whether your lungs are functioning at full capacity, or if there's room for improvement. And here's a little known fact. The stethoscope isn't just for the front of the chest. Doctors also use it to listen to the back of your lungs. Yes, your lungs wrap around to your back, and examining this area can reveal even more about your respiratory health. In essence, the auscultation phase is like a symphony of sounds that tells a story about your lungs. It's a narrative that only a trained ear can interpret, and it's a pivotal part of the respiratory examination process. Auscultation provides the final pieces of the puzzle, enabling doctors to make an informed diagnosis. It's a testament to the power of careful listening and the importance of thorough examination. So the next time you see a stethoscope, remember, it's not just an accessory, it's a key to understanding your respiratory health. So, to summarize, what are the key points to remember when examining the respiratory system? We've journeyed through the comprehensive process of examining the respiratory system, and it's a path that is both fascinating and crucial. Each step we've discussed plays a vital role in diagnosing a wide range of respiratory conditions, and understanding these steps is invaluable. Firstly, we dove into the world of tools necessary for the examination. Remember, your stethoscope is your best friend here. It's a tool that can reveal what the naked eye cannot see and the unaided ear cannot hear. It's vital to have it on hand and know how to use it effectively. Next, we explored the inspection phase. It's the initial step where we observe the patient's respiratory pattern, their color, and any signs of respiratory distress. This is the stage where you're laying the groundwork for your examination, forming initial impressions, and gathering valuable information. Following that, we delved into the palpation phase. This is where we get hands-on, literally. By feeling the chest wall, we can detect abnormalities such as crepitus or asymmetrical chest expansion that might indicate underlying conditions. The percussion phase came next, a unique process where we tap on the chest wall and listen for the different sounds that can tell us about what's happening beneath the surface. A change in the normal resonant sound could be a clue to a potential issue, such as a lung mass or fluid in the chest. Finally, we talked about the auscultation phase. This is where the stethoscope really shines. By listening to the breath sounds, we can identify any abnormal sounds like wheezes, crackles, or stridor which might indicate a problem. So there you have it, a whirlwind tour of respiratory examination. Each phase is critical, and skipping any one of them could potentially mean missing an important clue about the patient's health. Remember, a thorough respiratory examination can be the key to early detection and treatment of many respiratory conditions. Until next time, breathe easy.